Well, I did my dermatology residency at Albert Einstein, and when I was chief resident, I did a bunch of hair transplants. And I had some of the patients actually, after I graduated from my residency, come over to my place, and I wanted to see them. We hadn't seen any of the results. And I was actually aghast at the results that we see. We were using the old plugs. And this was in the 80s. And I swore in practice I would never do another hair transplant. And then I joined the staff at Columbia, and I saw over the years just people really not getting good results from transplants. And then in 1994, I went to the Toronto meeting, the hair meeting. I had heard that things had started to change. And Bill Rassman was doing these series of large sessions of micrografts, and I was really shocked that I thought the results were so good. And so I met him after the meeting, and he invited me out to his office in California. And I just was really blown away. And then I had this idea of using follicular units. What happened was he developed this densitometer. And he was using the densitometer to actually try to assess the donor area to try to more accurately determine how many grafts a patient had. And we were looking at through the densitometer and was seeing these groups of hair, and no one was transplanting them using these groups. Everyone was just looking at a strip as just a bunch of hair. And I said, well, why can't we just transplant these just the way they grow? And I wrote a paper on it called Follicular Transplantation 95. And I said, wow, this is really worth pursuing. And within 6 months, I decided to just dedicate my whole practice to that.